Thank you guys for joining us. This is our educational research for the non-Ph.D. And I'm joined by the lovely Drs. D. Coney-Berry, Dr. Ann Messman, and Dr. Mike Gottlieb. And I'm Frances Russell. I'm one of the ultrasound faculty at Indiana University, and we're putting this webinar on through the ASAP Ultrasound a research subcommittee, the research learning series that we have quarterly. So I'll briefly introduce our panelists. So I'll start with Dr. Ann Messman. She's the Vice Chair of Education for the Department of Emergency Medicine at Wayne State University. She is also the Medical Education Fellowship Director there. And she wears many other hats, including Associate Dean for GME DIO, which I didn't know what that meant.
They oversee all the residency programs.
Okay.
DIO does. The PDs report to the DIO technically.
Okay. She's also the program director for the 3-year MD program and the program director for the MD MBA program at Wayne State University. She recently completed a Master's of Health Professions Education at the University of Michigan and is the previous recipient of a $100,000 SAEMF grant in medical education research, and it's also completed the AAMC's Medical Education Research Certificate, or MERC. So welcome, Ann, and thank you for being here.
Thanks.
Next, we have Dr. Mike Gottlieb. He's the Associate Professor of Emergency Medicine at Rush University in Chicago. He's also the Ultrasound Division Chief and Fellowship Director there. He's authored a very merely 400 peer-reviewed publications and has only received $200 million in primary research funding. He's an editor of Academic Medicine, Annals of Emergency Medicine, WestGem, AGEM, AEM Education and Training. He's also the chair of the SAM Education Summit, the vice chair of Cord Academy for Scholarship, past chair of the Cord Education Committee, and a co-creator and chief strategic officer for ALIEM Faculty Incubator and the Director of Learning Assessment and Program Evaluation for the SAM Armed Med Ed course. So thank you, Mike. I'm glad you could find the time to join us with all the stuff going on. And last but certainly not least, we have D. Coney-Berry, who is the Ultrasound Fellowship Director at Columbia University. And she completed a Master's of Health Professions Education from Maastricht University. And her master's thesis focused on motivational factors that influence the adoption of innovations, and her current medical education research interests revolve around postgraduate professional identity formation. So welcome, Dr. Coney-Berry. I will say for the participants, if you have any questions that come up or like burning educational research questions that you have, please put them into the Q&A box and we'll get started. So I guess to begin, let's just talk about the different types of educational research, and maybe D, you can touch on what a research paradigm is. So,
sure. I really like, I think there's a lot of different ways to categorize education research. I really like the way that David Cook kind of described the categories or the purpose of education research by describing kind of categorizing research as descriptive research or justification research or clarification research. In the descriptive category, he kind of described as basically, this is what we did. This is kind of like the classic, this is the curriculum we put forth, and this is what our learners learned. So that's kind of one form of scholarship. And then in the justification category is like, did it work? And so this is a classic kind of comparing two different types of interventions. Did one work better than the other? And then for the clarification studies, these are the questions that kind of promote theoretical frameworks and push education theory forward. They ask questions like, yes, that did work, but how did it work and why did it work? And a lot of the research platforms that kind of support clarification studies, I guess qualitative studies kind of tend to support the platform of clarification studies. And so I think as far as research paradigms go, it wasn't a term that I was like familiar with at all until I did my master's. And I think like classically, we're all kind of like scientists, scientifically trained, and we learned about the scientific method where there's a truth out there. We're going to observe it, and we're going to kind of like put out what we observe as the truth. And that research paradigm is kind of commonly referred to as a positivist research paradigm, where there is an absolute truth, and we are able to measure that truth, and what we measure is the truth. And since then, I think the general science world has moved to a more humble place where we recognize that we're people who are fallible, and there are a lot of different factors that may play in our observation, and so there are limitations to what we're observing, and there's probably a truth out there, and what we're measuring is probably the truth, and these are the observations that are probably true. And so that's why in most journals we see a limitation section, and this is the post-positivist kind of research paradigm, which most research in science lays. And I think what's special about education research is that we kind of insert this third paradigm, which is known as constructivist. And there's other research paradigms, but I think a constructivist paradigm is probably more common, where we kind of evaluate truth depending on the point of view that we're coming from, and it's more of a subjectivist interpretivist point of view for measuring data and for presenting data. Sorry, I know that was a little long-winded, but.
I said great, most of that went over my head, but helpful to put it into perspective. And thank you for talking about the different classifications of educational research. Anne or Mike, do you have anything to add?
Sure. I'll just jump in if people feel overwhelmed. Dee is like very, very, very smart, obviously. So she has such sophisticated views. My very watered down version, not necessarily about paradigms, but just about education research in general, is that there's lots of truths. And even when we're looking at education theory and trying to say, I think that we all learn better when we're in a social aspect. And so I want to use a social learning theory. That can be true, but that doesn't mean it's the only thing that's true. So just you have to keep a very open mind in education research, because we're humans and we learn in lots of different ways. So just kind of keep an open mind that you don't have to pick one paradigm or one learning theory and say, this is for this experiment, this is the one. It can be multiple things. It's kind of nice because you aren't beholden to just trying to find like the one perfect explanation for why this happens.
I think just kind of stepping it even a little farther back from that, one of the things I think about when I'm thinking about education research in general is there's the traditional flavors we're used to in the non-education research, and we have our randomized controlled trials, and we have observational designs, and we have diagnostic type studies, and we're used to these things. And education just opens up another realm of ways we can study things that we may not have thought about before. You have a program you created, and traditionally we'd say, okay, well, I'm going to describe this, or I'm going to do a randomized controlled trial with this study, and that's what I got. But education research allows you to approach it from a few different lenses. You can say, I'm in an innovation report, and I'm going to describe what's innovative about it. The emphasis isn't really on the outcome so much. It's about what happened and what did I learn from this, and how can we now carry this innovation forward. So the innovation rather than the outcome is focused. Or it might be a program evaluation, and it's looking, evaluating the program from different lenses. And there's all sorts of theories that we can probably get into later if it's of relevance. But we're looking at a program in a much more 3D view. We look at, you can do something like a realist evaluation, which is a little bit more complex, but it's just looking at from different lenses. And so things that we are trying to evaluate when you add education research into this, it just opens up opportunities to study things in different ways that add value. You want to teach someone how to do ultrasound, that's great. And if all of our emphasis is on how effective ultrasound is for a given modality, well, that's really helpful until I try to go out and apply it and they say, oh, well, not everyone's an ultrasound fellow. So how do I actually teach people to use this? And that step gets missed. So I think education research also just gives us another opportunity to add to literature to better apply something in a way we may not consider with traditional scientific approaches.
Great. And you mentioned a little bit about educational theory. So we can maybe talk about that. Like, what are the different types of educational theory out there? And like, how do you decide which one fits best with your project?
That is a great question. It's complicated. And so when I'm done talking, I'll put in the chat an excellent resource that's offered through Academic Life and Emergency Medicine. It's called their Education Theory Made Practical series. They have, I think, 5 volumes published, free ebook. I don't get any kickbacks. So, this is my unbiased, although I did work on some of them, but they're awesome. So education theory, just so you guys know, if you're earlier on in your education career, if you want to publish anything in an education journal, you have to have used a conceptual framework or an educational theory to sort of justify why you think, let's say you're doing an intervention, you're saying this program could be better, and so I'm going to change this one element. And so when you're changing that one element, you need to have a reason behind why you think that changing that thing is going to result in more learning for your students. And that's where the education theory comes in. What's difficult about it is that when you're just getting started, you probably can't even name one educational theory. This is not like innate knowledge that you have. And so the nice thing about the Education Theory Made Practical series is that it spoon feeds you. Each volume has 10 education theories in it, and you just get to kind of explore it. It gives you a practical case, like an education case. It tells you what the theory is about. It tells you its shortcomings. It tells you where, like, other articles you could read about that theory. So I would just encourage you guys, before you get started on your first education research project, hopefully I'm not too late with this piece of advice, but number one, get a mentor that knows something about education theory so that you're not doing this all alone. But the other is to just kind of explore some of these resources, like Alium's books, to just kind of get an idea of like what theories are out there and how you could use them to make your intervention better.
And I think Anne had a really good point earlier as well, which was there's not often one singular theory that is the best way of doing it. There's a relatively famous paper written by George Berdage that kind of looks at, like, lenses in a lighthouse and the way you can illuminate, the way you do science or the way you do your study with different theories. And ultimately you can splice them from different angles. I've had projects where I've debated 2 or 3 different theories that could all work for it. So there's not like a singular right answer for it, which is both sometimes intimidating because you're like, oh, which one do I choose? But also not, because you have options. And as long as you can defend why you're doing that and justify it, you can use different theories. And if there's a better one, there's a good chance a reviewer will help hint you to it too. But that's where having that mentor is really helpful, to just, talk through and say, okay, I'm thinking about this theory. What do you think? How do you think it aligns? And they can, lay out other theories that may parallel it, that might fit better. Or just challenge you to think through, does this really align the way you think it does? But ideally, it's something where, you pair it with someone that has a little more expertise in this to help identify a theory that works well. And like anything else, we learn from the process. And then next time you do a project, you become really savvy. You say, oh yeah, I think this aligns with, community of practice because X, Y, Z, because you've learned that from the last round. So it does get easier each round, and you start to develop your theories that way a little bit too.
Great. Okay. You did mention, Anne, as well, finding a mentor. I think that can be rather challenging unless you know someone in particular. How would you suggest people go about finding an educational research mentor?
So one thing that I participated in Alium's faculty incubator. I think the first year they had it was like 2016 or so. And one of their first things that they made us do was you have to cold email somebody and ask them to be your mentor. And so I picked somebody that I had read articles by, and she was also a mom, and I just really admired her from afar. And I emailed her. I'd never met her, nothing. And what you'll find, I think, in the education world is that everyone is really, really, really nice and really wants to help. And so I emailed her. She was at UT Southwestern. I'm in Michigan. Like, it's not like we could even like meet for a coffee or anything. And she was really formative in my early years. So you can definitely do that if you're starting to read articles and a certain name keeps coming up, or you're listening to a webinar and someone strikes your fancy. I don't think there's any problem just cold emailing people. Of course, if you have a vice chair of education or a chair or somebody else that can kind of point you in the right direction, that's also extremely helpful, especially if you're uncomfortable with just randomly emailing a stranger. I'm curious what Dee and Mike have to say.
I actually really enjoyed being part of the Cord Academy of Scholars. I think that you can find mentors in a lot of places, and one of my current mentors I found via Cord, and it's been I think that that's so brave to email someone that you admire, and I certainly have my list of those people, but I've never had the guts to do that. So kudos to you, Anne. But I think meeting people in person sometimes is a little bit less intimidating for me. And once you're part of a network, that kind of begets more networks, and so joining like the Allium faculty incubator or taking one of the courses that are available will provide you with colleagues and mentors alike.
Yeah, I'm always surprised by how small this community is, but it's only small because you continue to know people. Once you know one person, it creates this almost snowball effect where then someone else knows someone, and you have this like second or third degree of separation where you're like, oh, I know that person. You don't know them, but let me introduce you. Right? And someone will connect you. And then now you have that person in your group. And, some of it's just, if you know someone at your shop that's published with or has some connection to that person, and you start to build that relationship out, you can do, and cold email and connect up with them that way. And a lot of people are, receptive to if you're writing a target email, like I read your work on XYZ, I'd love to pick your brain and learn about this, with an intention to what you're trying to achieve out of the email. I think a lot of people are very receptive to that as well. I think, it's also that, as Dee laid out, some of the courses as well. There's obviously value to learning in these courses, and there's tons of them, ARM Med from SAM, ASAP's Teaching Fellowship and Embers, you've got Allium Faculty Incubator. You have programs that exist in this, and you learn from those programs, but it's also who do you meet? Some of the people that I've met through, like one of the first ones I had taken was ASAP Teaching Fellowship, and people I've met through that now become long-term collaborators just because we sat together and we ate a ton of food together, and you like bond and you connect over that. And then is this like indirect piece of it. So some of it's just like, as you meet people, it starts to develop these, relationships, and you never know how it's going to work out from that. But I think that's probably been one of the more, for me, it's helped me to identify mentors, and just been, similarly formative for me to just learn and see different lenses to research and different ways I could approach it.
Great. So we talked a little bit about planning a project. So kind of being up to date on some of the educational theory and kind of deciding what you're going to use, and maybe having a mentor. What else would you guys say is helpful in planning an educational project?
So I suppose I can start this one off then. Like a lot of things, I think there's some degree of observership, and observership in research is reading articles and peer reviewing, and it's identifying that. I'm a big fan of peer reviewing, and ideally peer reviewing with a mentor, someone either like a group peer review or reaching out to someone that, does a lot of it, just getting feedback and starting to see how do they write it, how do they frame it, how do they do the discussion, and what are the things they either do really well, so you're like, oh, that's really cool, I'm going to, borrow that design for myself, or oh, I see that really, really big issue they made. I could totally have made that issue myself as well, but now I won't because I saw it. And one of the reasons I really enjoy doing peer review is it forces me to really think critically about, work in a way that I might not about my own work. But when I read someone else's, you can think about it, right? We're all really good at being backseat drivers for someone else's thing. But it forces us to actually think critically about a way that we may not with ours. And obviously it does a really good service for them too, because it helps them identify and improve their articles. So it really, I think, helps them and helps us in a similar way. And for me, that's made me a much better writer than I think if I just tried to write just straight out.
And I think it's really important, whatever you think your project's going to be, to do a decent lit search on it ahead of time. Sometimes you'll find that the exact thing that you are wanting to do has already been done, which sounds like bad news, but it's not, because go to the limitations and see what they screwed up or what they say in the future, I would do X, Y, and Z, and then you can do that if it hasn't been done already. But the lit search will really, really help guide you to create a strong research question and make sure you're not reproducing something that's already been published.
Yeah, I just want to echo Ann and Mike that when designing a project, we're really looking for is a gap. So the thorough literature search, we're looking to see what has been established and what's missing. And when we sift through what's missing, we also have to think about why that's important, why filling that gap is important, so that sometimes that's referred to as the hook. We have to tell our reader why answering or filling this gap is worthwhile. And so there's this kind of I guess, for lack of a better word, conceptual framework heuristic called problem gap hook that's put forth by Lorelei Lingard. And so she kind of frames it as in you'd identify a problem either in education or in general medical field, and then you tell the audience about what we currently know, and then you tell the audience about what we don't know and why that's devastating that we don't know that that information, and then you think about your brilliant study and how you're working to fill that devastatingly knowledge gap that we have. And that's how you can frame your study, is that you establish what's known, you find the gap, and you tell the audience why it matters.
Oh, great. Any tips you guys would give to a newer educational researcher? Things you learned along the way, or things that you wish you had known early on?
Sure, I can jump in. One thing that I was thinking, even just as we've been talking the last couple minutes, is a lot of times when you're doing your first few research projects, you might be tempted to use an outcome that's really easy to measure, or that's already out there. And the example I use is in-service scores. So a lot of novice researchers will say, oh, I'm doing this, if they're doing GME type of research, they'll say, I'm going to do this intervention on the residents, and to see if it works, I'll look at the in-service scores. But you have to take a step back and say, what problem am I fixing anyways? Why am I doing this intervention? And so an example where I used in-service scores, and it was probably not appropriate, was I wanted to change. I didn't think that the residents were doing their assigned reading. Like they were just showing up to lecture and they were supposed to have read a couple chapters of Rosen's, and obviously they didn't. And so I wanted to increase engagement with the reading. So I changed how their reading assignments were done. And my first inclination was to use in-service scores, but I didn't do that intervention because I was trying to improve in-service scores. I was doing it to see if they were engaging with the reading more. And so I had to change the study design so that instead of using the thing which is easy and available, in-service scores, I had to then figure out, like, well, how do I measure engagement? Because that's the thing I was trying to change. So you just have to be really careful that whatever the instrument that you're using to measure your outcome makes sense with why you're doing the intervention in the first place.
I think that's a brilliant point in making sure that they're aligning with the endpoint. I think it's also being creative with your outcomes. I think we tend to often revert back to sometimes simplistic ones, even if they align, of just relatively low yield ones. Like, did they like the course? Did they show up? Or did they do well on a test that I gave them at the end? And, we should strive, I think, to both try to elevate our game in terms of outcomes, things that are, if we're going to assess knowledge, well, let's use a validated tool. Let's make sure we have a tool that actually assesses what they did. Let's try to see if we can see a behavioral change. Maybe we can do a more, objective assessment of something like an OSCE, which is an observed structured clinical exam, or some type of assessment of what they're actually doing. We could look at, if they're doing ultrasound, we could try to see, how did their images change? Did they improve in quality and what they actually did in practice, not in this kind of artificial environment? Did they scan more? Did patient, if it's a specific thing, like I'm teaching them, biliary ultrasound, are they now ordering less radiology ultrasound? Are they getting patients throughput faster? Are we having more impactful effects? If I'm teaching them something, well, maybe not all the outcomes need to be what happened with them. And we can approach it a little more globally and say, well, some of the things is, what are the inputs? How much time did it take me to build this course? Because it's really cool if you had a course that improved their knowledge, a small amount, but if you spent hundreds of hours on it, is your actual return on investment for the time you spent on this, is it worth it? Was it really worth it for someone else to kind of recreate this for a very marginal benefit? What came into it? What changed? What did you learn from this process? I think the more we start to think through kind of different outcomes, we try to be a little bit more expansive, the more meaningful they'll probably be for others, and the more we can kind of really try to elevate what comes out of our research.
Along those lines, Mike, so say you're, for example, implementing a new ultrasound curriculum for a group of learners. And obviously you want to look at time, cost, resources that you're using, but then also maybe outcomes for the learners. Is that multiple papers? How would you kind of break that up?
Usually I'll have them in the same paper, unless there's something really different about it. If they're done the wrong same time period, it just helps to add value to the paper. It could be, and the way I think about it is, you can take a paper, and there's one of the more famous medical education papers is this concept of salami slicing, which you can take a paper and slice it down into 15 different papers, but then you have 15 minimally impactful papers. They're just this thing that you slice down really thin. At some point, it just gets repetitive, or you can have one more impactful paper. And so how I will often kind of start to frame my papers is, I'm kind of like thinking through, okay, I'm going to do a project. How do I maximize the yield for our team? Is I'm like, okay, at the beginning, I have to do a lit search. Well, assuming there hasn't been a review paper on that, that's probably a good starting point. As paper number one is a review paper saying, all right, this is what I've learned from this. This is what we know about the field existing, right? Now I've done this review paper. I understand the field. In fact, I understand the field better than I did before. So I can now be much more informed with how I do my study design. Then I'll do this, this intervention, and I'll maybe have a short-term outcome. That's my innovation report. I'll think about why it's innovative and what we learned about it. And I'll have software outcomes. I don't need a ton of things, because your focus isn't your outcomes here. You do need them, but the emphasis is what did you learn? What did you do? How you're going to change it? And then I make it better. And then paper number two is maybe a year out, and I'll do a bigger paper that actually evaluates this more comprehensively. Here's my program evaluation, much more inclusive thing. And then maybe if I can get another one a couple of years out, I'll do, okay, here's my delayed impact. And now this intervention I did to teach someone something, did it have an impact at 6 months? Did it have an impact at a year? I can now do that. And so each of those ones, I'm not splicing out the individual outcomes assessed at the same time period, but rather the time periods themselves and the type of papers, how I'll typically splice it out. I think you can splice out abstracts however you like, but for papers, I try to keep them all together where it makes sense. So you can have a much more impactful paper instead of, it's quality over quantity in that case.
And then another year later, Mike's going to publish another paper about why and how everything worked the way that it worked.
But that's great to kind of see how your project could then turn into a longitudinal project and have all these publications along the way. Because I think a lot of us in the ultrasound community are already doing a lot of ultrasound teaching, but trying to find ways that we can actually publish and turn this into scholarly activity. And so kind of what you outlined is a great way. One of the questions I was going to ask, because we were recently in a workshop together where you were talking about all these outcomes that me as a clinical researcher would never think of. Do you guys have any other outcomes you would look at And then specifically for like an ultrasound intervention.
It's got to be you too, because I don't know anything about ultrasound.
I guess one of the things that have been sort of, it's kind of hotly debated, is systems 1 versus systems 2 kind of thinking. Systems 1 is the pattern recognition, the quick thinking, often referred to as quick thinking, and then systems 2 is more of the systematic analysis of a problem, and a step-by-step analysis. And I think it commonly in education, we've defined system 1 as something that is prone to cognitive errors, and we make judgments too quickly, and bad things happen to patients. And so to kind of correct system 1, we teach system 2. We slow down and we systematically go through things. But there's like a series of kind of recent papers in the Air Force, actually, that trained pilots not on systems 2, but systems 1. And then there was another arm that tested pilots that trained on system 2. And it turns out that like pilots who were trained on systems 1 did a lot better in problem solving. And so while they didn't really understand the underlying mechanisms of like the step-by-step problem solving, the learning, the pattern recognition was an important aspect of just like problem solving emergencies, which is kind of interesting and counterintuitive to and counterculture to what we've been traditionally kind of pushing. And I don't know, I just thinking about the way that we teach ultrasound, I think that currently we still teach very much in the system 2. And I wonder, with these, if that could be an outcome of how to teach essentially ultrasound so that it maximizes troubleshooting, maximizes, I guess, learner comfort as well.
I think one of the areas with ultrasound.
Sorry, Mike, can I just interject with a
yeah.
question? There were a couple questions that came out. What do you mean by system 1 and system 2 in relation to ultrasound?
Sure. So I guess one example is, say we want to look at the gallbladder. We tell our learners to kind of either pan through the ribs or kind of go under the subcostal space in this like systematic way. You identify this, and you identify this, and you identify this, and then if you see this, then this. So we go through these like step-by-step methods, whereas system 1 is kind of more like, you see this, it means this. You see this pattern, it means that. And so it's more of a you learn a lot of combination of things to recognize at one time, which leads to a specific conclusion. So I think that if we're teaching like from a system 1 basis, we would maybe just look at pathology before we even start with, this is a probe, this is how you hold it, this is how we move the probe on a body. And so I don't know the answer. I'm just postulating. I hope does that help? Sorry, I think it was Rachel who asked that question.
Mm-hmm. Yeah, it was Rachel. Mike, were you going to say something?
Yeah, so I guess another way we can think about this, because earlier I talked about some of the outcomes looking at just like a singular intervention, but I think with an ultrasound, we sometimes get a little bit too broad with what we're trying to study, and that actually probably does a disservice. So if we imagine, let's say I'm doing a study that theoretically I just want to say how good is, ultrasound for identifying for B lines for pulmonary edema. So, and there's lots of studies showing this. But if you step it back, you say, okay, well, what's the training? And the training varies across studies. So what's training is best? I don't know. We take a best stab at it. Do I really need 3 hours and 25 proctor exams? Could I do this with 10 minutes? How much time do I need? And then we say, okay, well, we studied this, and we studied this amongst a broad group of users. So we had 3 fellows, 2 attendings, 7 residents, and 4 medical students. And that, I will say, as a reader, means very little to me, because I don't know, unless everyone was perfect. If it's anything less than 100% accuracy, I don't know who's dragging it down, right? Is it something that's being elevated because the fellow did all the scans and the fellow's really, really good? Is it because the medical student, wasn't trained enough? Or maybe they were really, really awesome and it turns out the fellow wasn't. Like, we don't know. And so trying to partition out, okay, a given learner level, so I can compare to me. How I scan is different than how my resident scan, and how the community physician who hasn't done ultrasound 10 years scans. And we need to know how it actually applies to that user. It's a lot. This is one of the most user dependent skill sets. So we need to know how it actually applies to user. And so partitioning that out. And then we say, okay, cool. So we did that. But how do we ensure they're actually competent in what they're trying to do? How do we ensure that they're actually skilled in doing this? I don't know. We presume 25 sounds like a magic number. It sounds really good. Someone came up with 25 one time. We did a couple of very soft studies that 25 probably is okay. And then we just went with it. And we got surprisingly committed to this 25 to 50 range without really good data at all, saying that's a really good number. And you might argue that a number probably isn't even a good metric, because we should really assess competency with a much more valid tool than numbers. But they say, okay, so we at least determine they're competent. And then when you do 1 scan a year, how long do you retain that skill set? Well, we don't know. How long do we, I mean, I have seen people who have gone to, programs that have had really strong ultrasound focus. They don't use it for 4 years. And then they come back, they're like, I need a refresher. I don't feel very strong with this anymore. The skills dissipate. So the same study of just E-lines for ultrasound, actually there's about 15, 20 different studies you could do off this to actually dissect it out and answer the questions that allow us to apply this better. And I would challenge us maybe to start to push that direction too. We don't have to, I love the novel stuff and I think it's really cool, but I think the core stuff that we have, there's so much room to delve into that and better understand it. I think we just sometimes miss the opportunity right there.
So along these lines, I think something we all struggle with is, where are we publishing all of this? Because I feel like it can be quite challenging to publish ultrasound educational studies.
All you, Mike.
Yeah, it's all you, Mike.
Mike, are you blocking all of our publications since you're an editor of all these journals?
I think I have too many COIs with people I know well, but it's hard. It's hard to publish education research.
And this will be recorded and posted on the ASAP website.
No, but it is hard. It's hard to publish education research. I think some of it is that we don't do higher level outcomes, and there's a lot of studies that come out there and saying, that the primary and potentially the only outcome is either satisfaction or perceived competence. I feel better about the skill, and I think 30 years ago that was totally fine. But where we are in 2022, the rigor is higher, and I think that's usually one of the bigger factors in why paper might not get pushed forward, or was brought up a couple times earlier, is not having an educational theory and not understanding the informing rationale of why you would do this. So I think identifying some of these areas that are going to cause editors to be more commonly either desk rejected, which I will caveat that I think desk rejection is a really nice thing, because it means I can get the paper back and submit somewhere else, rather than sit in peer review for 6 months and then get it back and have to submit somewhere else. At least I can move quicker. If they know they're not going to accept it, tell me now, rip off the Band-Aid and let me move on. So I don't mind that, but it's helpful to know what things you can identify so that doesn't happen. There's lots of journals that do accept ultrasound research and ultrasound education research, and Francis and a few of others are actually working on a post that will come out soon in the ASAP US newsletter with a whole table of all the different journals. So I'm not going to list them out here because it would be a very long length of it. But the bigger issue is, how do you pitch two things? One, why does it matter to the journal, and why is it novel? And I think if you can do those two things, it'll be more publishable. What's novel about? What stands out? What's that problem you have to look? How is this? Why is this a critical need, and what is the study doing to meet that? And then why is it aligned with this journal? If you go to a journal that's very clinical focused and you say, I'm going to do a study in residents, they're like, why? You have to pitch why it matters to them. And I think if you do a stronger pitch to why that journal, what that journal is looking for, you'll have a much better success with that. Same thing if you went to a primarily education journal and they're like, oh, you're doing EM ultrasound research. It's a very small niche. Well, why does this matter to the broader education community? So your pitch of them are very different for the exact same study, depending on the journal. And the more time you put in that pitch, the more likely they'll actually consider and potentially accept it versus saying it's outside our scope and moving on.
So what pitch are you putting to the education journal? And also a question for all of you is, how are you writing in that educational theory? So say you're doing, what is it, Kirkpatrick or something like that. How do I actually describe that? Is that in the methods? Is that in the discussion? Is it both? Can you give an example?
So I was actually teaching a class 2 days ago about education theory for one of the education scholars programs at U of M. And so I did sort of like extreme examples so they're easy to digest and understand. In terms of where you put it, I tend to put it in the intro plus minus the discussion, but definitely in the intro when you're explaining why you think that your intervention was going to work. And so the example I gave them was, and this is a true example to an extent, that where I work, if we don't meet metrics, like we have a long bone fracture metric, where if the patient doesn't get analgesia within 30 minutes of registering, then I get dinged, but it's actual money that comes out of my bonus. It's like $500 with each miss. It's big. And so I explained that if I were explaining this, the problem is physicians are missing this metric. My solution is that I'm going to charge the physicians money, and I'm going to run this example through and do it in experiment. And I'm sure that compliance is going to increase substantially. But the way I would explain that in my introduction is that here's the problem. I'm going to use a behavioralist solution to this problem. Behavioralism it's lots of things, but in this example, it's carrot and stick. So if you miss the metric, you get a stick, which is lack of money or money taken out of your bonus. And so I would explain in my introduction, here's the problem, here's how I'm using behavioralism, which is my learning theory, to address this problem. And then my hypothesis is that by using this behavioralism intervention, I'm going to have increased compliance with meeting this metric. And of course it works because, it's expensive, but that's how you would use it. Anytime you're addressing a problem, you're going to want to say in your introduction how that learning theory has helped you shape your intervention on that problem that you're addressing.
Yeah, I agree. The vast majority of the time it's introduction or discussion. Occasionally in the methods, if I'm describing a program that we're creating, I will put in the methods because it will often inform. We developed this program based on XYZ. And so as I'm describing this program, because my intro might be my gap of what's needed, when I want to talk about the program I built in the program evaluation type study, then I'm use I'm add to the method section when I'm describing it. But I think those are generally the areas. And I think the other thing is separating out the learning theory from the theory or the framework you're using when you're trying to describe your assessment or outcome or your evaluation or outcome. So if I'm assessing outcome, that's where Kirkpatrick will come in. It's often not in Kirkpatrick, which is a system of, typically is 4 levels. And it'll be like, satisfaction and then knowledge and then attitudes and broader, more system level outcomes. That isn't really telling anything about what I designed. That's a framework for how I'm going to assess, how I'm going to, evaluate my outcomes on it. Or if I'm going to do program evaluation, I might say I'm going to use a logic framework or a SIP framework. And that isn't anything to do with my study. So if you have something you're using to frame your outcomes, that's great. But keep in mind, that's not the education theory to understand what you actually did. It's just a way of thinking through how you're going to assess your outcomes. And just be careful to kind of separate those two things out because they'll probably ask for another theory to support it if you're relying just on Kirkpatrick as your underlying theory.
Great. We did have another question. Can you talk about module creation and how best to maximize the impact besides potentially getting a group to do a pre and post test about the content in that module? This question may be touching again on outcomes, but maybe not. I don't know. Do you guys want to take a stab at that question?
I think I can't really, I'm not sure what this person is asking about module creation. They can maybe put more information in the Q&A. But in terms,
Oh, and
sorry,
you're
I just muted myself. In terms of maybe, so in terms of outcome assessment, I think it's what Mike was talking about. Like you can create a module that's going to teach an ultrasound skill, for example. And one way to test it, did it work, would be, here's a pre-test. Guess what? They were all really crappy at, doing a gallbladder ultrasound. And then you do the intervention and you do a post-test and they're all great at it, which is like not a very helpful study, because if you intervene on people and teach them about anything, you have big problems if they didn't improve in some way. But like he was saying, you could look at it more systems-based things, like, if you're doing that and now they don't need to order the formal radiology ultrasound, is that shaving time off their length of stay? Is it getting them to, if you're teaching them ectopics, is that getting the patient to the operating room more quickly? Things like that. Like you can look at outcomes beyond just a simple pre and post test. And as we were talking about, Francis, you mentioned Kirkpatrick. So that's like a pyramid, and the bottom is like the lowest level outcome. And that is when you ask learners, hey, did you like this? Did you like this module? Was it helpful? Was it cool? And that would be, sometimes that's important, but usually that's a low level outcome for a reason, because it's usually not. The step above that would be, did they learn something? Did they get knowledge? The third would be behavioral. So you could also look at, all right, I taught them this skill, I gave them this module, but did they still keep ordering the radiology formal ultrasound? Or did they actually use their skills? And then the highest, the pinnacle, is patient outcomes. So, did the patient get to the OR faster? Did the patient have a decreased length of stay? And so just so the listeners on this call understand that the conceptual framework or the learning theory that you're using in your introduction has to do with, why did I think that creating this module was how did I think that was going to help them learn? But when I'm talking about Kirkpatrick, that's at the end. That's in your discussion, where I'm saying, in this study, I measured Kirkpatrick level 3, where I looked at behaviors and I looked at, did they order less formal I don't think you guys like the word formal ultrasound. Radiology performed ultrasounds, or did they not change?
You're so ultrasound savvy, Anne.
I get yelled at by Dr. Ehrman quite a bit when I say formal ultrasound. And he's like, this is a formal ultrasound. It's just, done somewhere differently. And so if you're looking at like a change in behavior, that would be really cool. I would love to know, did your module teach them where they felt confident that they didn't need to order the radiology performed ultrasound?
It's much harder. It's much harder to achieve the higher levels in Kirkpatrick, especially the patient level outcome. It's almost, very difficult to attribute one learning intervention to a patient outcome. But
Okay, we only have 10 minutes left. I know we kind of talked about publication outlets. We talked about journals. Where are other places? I know there's MedEd portal. Are there other possible options for kind of disseminating this?
Definitely conferences, and you don't have to go big. Like at Wayne State, we have something called the MedEd Research and Innovation Conference. It's a very it's a low bar to get accepted into it, but it's some place to start. And I think it's really encouraging when I have medical students or residents that want to do med-ed research, like because they'll get in, and so that feels really good. And then they get to present their poster and they get some feedback. SAEM and others have regional conferences. Those are also great. Usually not quite as difficult to get in as the national conference. But I think conferences are a great place to start and get some preliminary feedback on the work that you're doing.
And I'm also a big fan of innovation reports as a model. If you have something that is innovative, because they're not going to push you as hard for the outcomes. So you can talk more about, what was innovative, how can we learn from this? That's in paper form, but there's also a number of different conferences will have, you can do that as a lecture. And is it an example, EUMC that every year they have like, here's something innovative I've done. That may be another outlet for this really cool project you did. They actually wouldn't even compete with publication. You could still publish it. It's just another way to share this with other people and have an opportunity for yourself or for one of your mentees to go up on stage and present something and get, academic recognition and opportunity to, develop their skill sets as a speaker, as a leader in the field. So I would just think about, not everything needs to be a publication. Similarly, blog posts and, LIM has a series on this and several others do as well, where you can just kind of share your innovative ideas that, again, don't preclude publication. It's just another way to get information out there.
The AAMC actually has an annotated bibliography of all journals that have publishing with medical education. So if you just Google AAMC medical education annotated bibliography, there's like a list of like 100 journals. And they do a really good job of like they say, this is the editor, this is the type of articles that are often published. And that's another resource to look at.
That was the AAMC medical education annotative bibliography.
Yeah.
Great. We did have another question. So can you give examples of items to include in small grant applications that may help with educational research? What do you list in your budgets? RA funds, survey tools.
Anything and everything you can to make sure you get the most amount of money out of the grant is probably the more summative term. But I would try to think about what's going to be the biggest value to you. If you're doing qualitative research, maybe I want to have, use a program like Deduce or one of the other programs. Maybe I want a research assistant who can at least just capture and enroll people. Maybe I want to give participants money because people do better if you pay them. So if I pay them to do stuff, to engage in something, I'm more likely to get them to either respond and or complete something later. As an example, we did one of my first grants was looking at podcasting, whether people, this is not Ultrasound related, but podcasting, whether people learn the same driving versus, just sitting undistracted, and was driving a distracting factor from podcasts. And I wanted to know, not just does it help in the initial sense, but a month later, and it was all residents. So trying to get residents to complete a survey a month later when they're busy and they're doing a million other things, it's really hard. And so I ended up using the vast majority of the funding to do gift cards. In fact, the residents went out more than I did because I got zero money on this, but the residents got, $25 per survey. So they ended up listening to 2 podcasts that were EM based topics. They got $50 for the survey and another 25 for the delayed recall. And we got 100% response rate, every single one of them. It was great. And so that sometimes might be worth it to avoid the stress of you having to track them down, because you're like, oh, you're paying for this. Then it values the time they're spending on it. And maybe it's conferences. Maybe it's just so you can go somewhere for free. And you know what? I will give a 10-minute presentation at ASAP and I'll get funded to go there for free. Totally worth it. Just think about the things that are of value to you and what are the most difficult parts, and pay for that. One of the things I learned for Rush is that we can actually rent RA time. So I can actually just put together $10,000 and buy X amount of hours of RA time without having to invest in a permanent RA. And I think a lot of institutions are moving towards this model. So that's another thing you could consider is you don't have to figure out the funding for an entire year of RA salary. Maybe it's just enough to help you out with whatever part you need.
And make sure you read the grant application instructions very closely, because they will often tell you what you can and cannot use the money for. Like the SAEMF grant that I had, it was only for salary support. So if I wanted to have to pay for a statistician or to travel or something, like I could not technically use that money in that way. But also pretty much every academic institution is going to have someone who's a genius at writing these things and will figure out the most creative ways to spend money. Like if you have $10,000 and you're like, I really don't need this, like I can't use it for salary support, I can't pay myself, they will come up with in 5 seconds a way to spend $10,000. So figure out who that person is and then make sure you use them to help you come up with your budget. It shouldn't really, especially your first time through, it really shouldn't be something that you're doing by yourself.
Absolutely. I think one of the other things that I wish I'd known with one of my earlier grants is some grants will limit you to the NIH allocation of your funding. So like you may make more than $197,000 a year, but they'll cap you at $197,000. So everything above that amount, your department pays, which they don't really like because now they're paying extra. And so some grants will actually cap you at the NIH amount, and you have to figure out funding to meet that difference. And that's one that it will say it in the fine print, but that's a reason why you always want to talk to someone who's savvy with grants and make sure your department leadership's on board, because some grants will require them to actually invest in you and pay part of your salary, balanced with the other portion covered by the grants.
Great. I think to end, any other resources or conferences or things that we can do to improve our education of educational research?
One of my favorite podcasts, it's kind of nerdy, is the Key Lime podcast. It stands for Key Literature in Medical Education. And it's a group of really amazing medical educators, mostly from Canada. They talk about one journal article, and because they're all so knowledgeable, provide a lot of the background leading up to that particular research study. And it's really, really fascinating kind of listening to how they think through the problem and how they analyze the paper. It's I've learned a lot from it, and it's good commute listening.
I agree. Love the Key Lime podcast. Also Key Lemon podcast by our own Dr. Messman. And then along those lines as well, there's a lot of courses that, I think you kind of look to and figure out where your needs are. A lot of the kind of the more primer courses, things like ACE Teaching Fellowship and Embers, and looking at, Merck Cord will kind of be good starting points of it. There's some of the more slightly advanced courses like LIM Faculty Incubator. There is the SAM ARM MedEd course. And then, there's also just there's tons of free resources, and figure out the one that aligns with what you like. I also like Education Theory Made Practical. Full disclosure, I'm an editor on a lot of those books, but I actually do find them useful. That's why I do free work for it. But I think you find the resources you like to learn from, and whatever's going to kind of help to push knowledge towards you. So it's not just you trying to seek it out, figure out, oh, this is a new theory I didn't learn about. This is a new approach or a lens to it. Whatever works for your learning style is probably the right one.
Yeah, and my plug would just be to get a mentor that can help kind of guide you through this process, that knows the resources, that can talk to you and figure out what your needs are specifically. Like, do you want or need to do an entire like year-long faculty development course, or do you are you not that super invested yet and you want to just check things out a little bit? I think a mentor is invaluable in helping guide you through this process.
I just want to quickly address one of the comments about, I think it might have been response to me saying that it's hard to measure the higher levels. So Kirkpatrick, I didn't mean to discourage anybody. It's harder, but definitely not impossible. And it's really rewarding when you see that change in behavior. We recently instituted this longitudinal PA ultrasound program, and like really surprising to everyone in the program, we saw a 100 fold increase in ultrasound use clinically. So that's a pretty significant increase, and that was very heartwarming for all of us to see. But yeah, not harder to measure, but not impossible.
Great. Well, I think we can wrap it up there. Thank you guys so much. This was really helpful. I learned a lot of stuff. I'm excited about the Key Lime podcast and the Educational Theory Made Practical series. Never heard of either of those. So I'm excited to kind of delve in and learn more. And just thank you so much for your time and knowledge.